Intubation is the process of inserting a tube called an endotracheal tube through the mouth and then into the airway. This is done so that a patient can be placed on a ventilator to assist with breathing. Why is this so important? Well, we can only go 2 to 3 minutes without oxygen before we have brain injury. Intubation seems to be relatively simple, but there are many complications, the majority of which can be prevented, saving lives and money. Our device will reduce these complications. There are over 40 million intubations done in the United States every year. 90% or 36 million of these are done in the operating room. 8% or 3.2 million are done in the ICU, and the rest are done in the emergency setting. In our largest market segment, the operating room, there's a 6% incidence of tracheal injury during intubation, adding an extra day to the patient's hospital stay and $2,000 in hospital costs. That's a total of $4.3 billion in hospital costs. The ICU also has a high prevalence of complications associated with intubation. The 1.5% prevalence of pneumothorax during airway exchanges kills 1,100 people and costs $311 million annually. Daily verification of tube placement using chest x-rays is a standard practice in the ICU and costs the hospital $3.2 billion annually. Currently, these chest x-rays are not reimbursable. Most complications arise because the provider cannot monitor the tube depth or placement. Even with the new video laryngoscopes, markings on the tube are hard to see, especially with difficult airways. Our solution is to color code endotracheal tubes to monitor depth and placement. Colors are easier to see than markings that are currently used. Colors seen at the vocal folds indicates tracheal depth. Yellow prompts the provider to continue advancing. Green indicates proper placement of the tube. Red indicates that the tube has been placed too deep. There are 200 million tubes sold in the United States every year. Simply color coding the tube will save lives and drastically reduce healthcare costs.